said so much about this system of JESS. You know that what is JESS? JESS is for the beginners. It is Joshi's just to honor the legendary figure of orthopedics, Dr. B.B. Joshi. We have named this system with Joshi's external stabilization system. So we stabilize the fractures with this JESS system. It is not a fixator because sometimes we use it just to stabilize the soft tissues and for the correction of deformities. So to call just fixator is a misnomer. Rather, the better word is JESS, that is Joshi's external stabilization system. After all, what is JESS? It is a very simple system, rather the fixation system. It is light, very light, a few grams it weighs, even for the bigger frames. It is highly modular. That is the beauty of this system. Then it is a mini external fixation system which systematically addresses a wide range of complex problems in the management of trauma, deformity correction and reconstructive surgery. Dr. Joshi was working in an ESI hospital and he had lot of hand traumas there. He had always the feeling that he doesn't have the system to stabilize the soft tissue. So he devised a external fixator that was indigenous because those days the many external fixators were very costly and they were not available in India. So he used already Dr. Prakash told that he had the electric plug and he had the innovation out of that and made a simple fixation system to address the mutilated hands which came to his hospital. It is not only for the trauma but also for the deformity correction, and it is really practiced all over Asia and in few countries abroad in the world for the CTV correction and for the reconstructive surgery. It has a high safety profile and it is unparalleled ease of application. Any young orthopedic surgeon can learn it, and once you have attended a workshop on JESS, you can go back and if you have the link joint with you, you can apply it in simpler cases. So that is the beauty. Too much of armamentarium is not needed with JESS. Today we dedicate this JESS session to Dr. B.B. Joshi. Today is the Guru Purnima. So it is really, I feel proud and it is a proud privilege for me that I have been given the opportunity on this day that we are conducting a session on JESS system today. How this JESS system has evolved. It started as a small clamping device to hold a fracture externally. In hand, it was used initially, developed into a system which could be used in the mutilated and crushed hands to give a functional position to the hand. In my postgraduate days, we had no system to stabilize the crushed injuries of hand. We used to do the dressing and the patient used to cry in pain, and by the time the wound will heal, the fractures have united with the small union. Now it has expanded to deformity correction using the concept of distraction histogenesis. We have learned a lot about the distraction histogenesis in Lizarro. Dr. Joshi has added to it the differential fractional distraction. That is, both the sides, the convex as well the concave side, both are distracted. So Dr. Joshi has coined the word differential distraction. It has evolved into a comprehensive system which could handle trauma, both of the upper and lower limbs in pediatric to geriatric age group. I have used the system from head to toe. That is the beauty of this system, and it is versatile. In complex situations, if I don't have anything else to give to the patient, I can at least give a functional result by using the JESS. It has developed into a whole system that encompasses not only the treatment of trauma, but also the correction of various congenital and acquired deformities, burn contractures, and reconstruction of the thumb. It is how it has evolved from electric plug. Then it came to the mind of Dr. Joshi that why not to use this to hold the K-wires and the connecting rod by this simple electric plugs. And this is the pivot around which this system is evolved. This is the link joint. You must get yourself familiar with link joints, and every orthopedic surgeon should have a few link joints because he can use the K-wires and the link joints to address the simple fractures of the hand by this link joint and connecting rod. He can make out of the thicker K-wires. So he just needs a few link joints and the K-wires to apply this fixation system. Otherwise, it has evolved now into a comprehensive system with dissection rods and other components. Mrs. Sandhya Kaushik will be discussing about the components part. So, friends, we have been learning the method so far. No doubt the principles have been discussed in 1.5 days, and always give emphasis to the principles. That is, that reset the soft tissues and bone will follow. That is the principle. So, in dissection histogenesis also, this principle applies. Dissection histogenesis concept based on Elizarov work and added to it by Dr. Joshi is the differential dissection. So, there are 3-4 words you must know about them. That is, one of them is differential. Differential, that is, the convex as well the concave side are dissected but differentially. That is, the concave side as well as the convex side are being dissected at different rates. Then comes the fractional. It should be fractional, that is every 6 hours, 12 hours, every day, like that. It should be not in one go, because you have to give the tissues to elongate. So it should not be acutely dissected. Then, as the principle has been expanded, the concept of tissue lengthening in many congenital problems. The JESS design maximizes construct stability, minimizes stress at the pin-bone interface, and decreases the incidence of pin loosening. It is very versatile. You can use it at any place if you have the basic set with you. System which can be applied easily by any surgeon in even the most remote areas with minimum instrumentation. That is the beauty of it. I time and again emphasize this, that even sitting in the remotest areas, if you have the link joints and the K-wires, you can apply this system. It provides a simpler alternative to the presently available modalities of treatment. Every system has the beauty. If you know the principle and you know the right method of application, then you have the least complications. I have compiled few tips how to put the K-wires and how to put this JESS frame and other external fixation. I will be providing you with those tips. It provides a simpler alternative to the presently available modality of treatment and allows minimum invasive technique. Its application I already discussed, and we will be taking them separately also, and you just see that how this has evolved. It was a stabilizing system for the crush injuries of the hand in the beginning. So it was so easy to address the mutilated hands by application of this frame. This is how we can put the hand in the functional position. Otherwise, the functional position of the hand was not possible, and this fixation system was not available before 1980. And once the wound has healed, even the bones are being taken care by this fixation system. They are put in the reduced position, and by the time the wound has healed, even the fracture has become sticky, and you can remove the frame in the OPD. Professor Joshi's Vishwas Vidyadan. It is being fulfilled by his associates in the form of series of books with his monumental work and conducting workshops. We have conducted more than 130 workshops in India and abroad so far, with the hope that many surgeons who read these books and attend the workshops will find the light of knowledge to guide them in their clinical decisions. So you have to learn the principles and the methodology, and then you can innovate. Start with a simpler frame, and then you make the complex frame, and then you can innovate. Don't innovate in the beginning. If you learn the methods only, you get stuck with those methods. But if you learn the principles, you can devise your own methods. So friends, I just now invite Mrs.